Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist and cornea specialist, and joining me today is Dr. Sarah Maki, a glaucoma specialist in the Phoenix metro area. And today we're going to talk all about glaucoma. So Dr. Maki, can you tell us how you describe glaucoma to your patients?
Yeah, glaucoma is really a plumbing problem inside of the eye. That's the easiest way to think about it. It's a drainage problem on the inside of the eye. If you think of your eye as a bathtub, there's really a faucet on the inside separate from the tears, and then there's a drain that's draining that fluid away. It's what keeps our eyeball formed. If you have a problem in the drainage system, then pressure backs up inside of the eye, just like water will fill in a bathtub. That pressure can really lead to damage to the cable that connects your eyeball and your brain, which we call the optic nerve. If your nerve becomes damaged, that's what defines glaucoma, and the reason we care about it is because it can cause you to lose vision, and that vision loss can be permanent.
So how do you know if you have glaucoma?
So glaucoma we think of as the stealer of sight inside the eye. So for most people, they don't feel it, they don't know it, and if you don't go to get a regular routine eye exam, you might never know you have it, unfortunately, until it's too late and you've lost a lot of your vision.
Who should be concerned about glaucoma?
Well, we know that your risk increases as you get older. Glaucoma does have a tendency to run in families. There's a genetic component, but sometimes glaucoma can be caused by other things. Certain medications can cause your pressures to rise within the eye, namely steroid medications, creams with steroid in them, inhalers that you can use, or even being on oral medication. Sometimes you unfortunately can be born with glaucoma or acquire it from a young age. Those are usually for patients who have difficult or different anatomy inside of the eye that causes their drainage system to develop abnormally. But really, most people have some sort of a risk for glaucoma. Diabetes can cause glaucoma inside of the eye, so routine eye exams are extremely important, and your eye provider should be able to tell you if they have suspicion for it.
So when someone is diagnosed with glaucoma, what are some of their treatment options?
So glaucoma is really treated 3 ways inside of the eye, and all of the treatment is aimed at lowering the pressure to protect that nerve tissue. Nerve tissue is irreplaceable, so that cable connecting your eyeball and the brain is really important and something that we have to protect. We protect it by lowering the pressure. You can do that with medicines, with laser, and with surgery.
So how do you determine who gets medicine, who gets laser, and who gets surgery? Is there one that you would go to first, or does it depend on the patient?
So studies would suggest that medicine and certain lasers are really pretty equivalent. So starting out, simple things being simple, you can start with a medicine, or if somebody is intolerant to medication for some reason or doesn't want to take a drop every day, they can use a gentle laser on their drainage system. For obvious reasons, surgery is kept later on in the treatment model, with the exception of cataract surgery, where we can treat and help glaucoma along at the time we're taking out cataracts.
Tell me more about the different kinds of surgery options that we have available for glaucoma.
Yeah, so glaucoma surgery really is separated into 2 categories. You can think of it as bypassing your natural drainage system completely, or building you out a brand new drainage system, or working within your natural drain to try and get it to function better, to get rid of all that pressure, trying to unclog your drainage system. Unclogging the drainage system can be done at the time of cataract surgery, and there are different ways to do that. Building you out a new drain can be done at any time, but bigger risk, bigger reward.
What are some of the risks that patients might expect after glaucoma surgery?
Well, glaucoma surgery is not for the faint of heart. They are bigger surgeries than cataract surgery or LASIK surgery that maybe patients are more familiar with. Bleeding can happen at the time of glaucoma surgeries, infection. Anytime we do surgery, you can lose vision, and so we don't take that on lightly. But for most people, a lot of glaucoma surgeries can be very successful and help to get you off of drops and help with your glaucoma.
Medicines, lasers, and surgeries, are these cures for glaucoma?
Unfortunately, glaucoma is a chronic disease, a lot like blood pressure or diabetes. It's something that can be managed over time and doesn't necessarily have to lead to blindness, but it's not a curable disease.
Well, thanks for joining us, Dr. Maki. If you have any questions about glaucoma or other eye diseases, feel free to leave a comment down below. And stay tuned for another video with Dr. Maki coming out in a couple weeks about whether cataract surgery can treat glaucoma. We'll see you in our next video. Bye!